Good afternoon. We'll now start. I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or your email address in the chat box. Please include the names of your companions attending with you. Use the chat box to ask questions and to make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Another reminder is please take the online learning home evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown below. I have placed the link in the chat box. Another reminder, 50 OLETE certificates will entitle one to receive one voucher for ROJoson telemedical consultation. Another request is that those who are not planning to take the OLETE, because in the OLETE I asked for a feedback to my pep talk, please just type your feedback in the chat box during the open forum. Thank you. We will now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face in the video. Okay. Ready? Ready? Show your face. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. So the following are the contents of the core course. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses as shown here. Okay. This may take 3 years or longer depending on the enthusiasm of our participants here. My pep talk today is entitled Urinary Tract Infection, Fundamentals and Generalities. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities of urinary tract infection or UTI in their health management. Some definition of terms in the title. When I say fundamentals, I mean the basic principles, foundation, and basis. Generalities means majority, not all, not detailed, non-specific, because I cannot cover everything. Okay. That's why I use this particular words in the title, and then this will be guided by the content. Okay, fundamentals and just generalities. Management means the usual medical management being done by doctors. The contents of this module will be what is urinary tract infection, what causes UTI, what are the preventive measures, what are the symptoms and signs, what are the usual diagnostic tests, how to interpret the diagnostic tests, how to collect urine to prevent contamination result in the urinalysis and urine culture, what is asymptomatic bacteriuria, how to manage it, how are UTIs being treated, and what is the prognosis, what are the ROJoson's advocating statements and advice on UTI. Let's now go to the first topic. What is UTI? UTI is a commonly expressed term by both physicians and patients in the Philippines to the point that practically all patients know what UTI stands for, urinary tract infection. So may UTI ako, may UTI ka. But what exactly UTI mean? And what exactly is its true significance? How exactly should it be managed? So a lot of people or lay patients do not know UTI fully, thus resulting in disproportionate anxiety, maraming natatakot, okay, unnecessary and low value diagnostic tests, doing a lot of tests that are not really needed, and then unnecessary and low value medications or drug prescriptions, especially by physicians. Okay. So that's because of those reasons, that's why I thought of this topic for today, this pep talk. Okay. So UTI is urinary tract infection, or it is infection in the urinary tract. But what is the urinary tract? The urinary tract is a tract or passageway in daanan ng ihi, starting from where the urine is formed. As we know that the urine is first formed in the kidney, and then it goes to the fluid called urine will now flow into the pelvis. This is the pelvis, and then to the ureter, okay, and then to the urinary bladder, and then to the urethra, and then to the outside wall. Okay, so that's the urinary tract. Infection in the urinary tract can occur in these 4 areas. In the renal or kidney pelvis, when you have infection here, focus on this area. That's what we call pyelonephritis. Pyelonephritis. Pyelo means pelvis. Then ureter, if you have infection in the ureter, you call it uteritis. Uteritis is very rare. Okay. Urinary bladder infection, cystitis, or urinary bladder cystitis is most common site of infection. And then urethra will be that in the urethritis will be that in the urethra. Okay. So the most common is still cystitis. And the more severe type will be your pyelonephritis. UTI is usually caused by ascending, yung paakyat. Ascending means paakyat. Now from below going up, okay, of the urinary tract, from the urethra to the urinary bladder, upwards to the kidney. Okay. But sometimes blood-borne infection can cause UTI, particularly pyelonephritis, without going through these pathways. No? Okay, pag may blood-borne, pwedeng diretso na sa kidney. No? More than 90% of the bladder infection, as I said, the bladder infection is the most common. Okay, so this 90% are caused by the so-called E. coli. E. coli is a bacterium normally found in the intestine. Okay. The risk factors for UTI will be being a female is a risk factor because of the female anatomy. A woman has a shorter urethra than a man does, because man has a penis, depending how long, okay, which shortens the distance from that the bacteria must travel to reach the bladder. Okay, when you say bacteria, it's usually from below, from the puet, from the anus, now bacteria from the puet going, because the puet is just adjacent to the urethra. Okay, then it goes, the bacteria goes into the urethra and then goes to the bladder. Sexual activity is another risk factor. Sexually active women tend to have more UTIs than do women who aren't sexually active. Then certain types of birth control, women who use diaphragms for birth control may be at higher risk than, as well as women who use spermicidal agents. Menopause, because of the age factor, menopause, a decline in the circulating estrogen causes changes in the urinary tract that makes one more vulnerable to infection. Other risk factors will be urinary tract abnormalities, and then blockages in the urinary tract like stones or prostate gland hypertrophy, yung nagbablock ng daanan ng ihi, a suppressed immune system like diabetes mellitus, and then the use of catheter for those who are hospitalized or those who need to have a catheter inserted. So these are some of the other risk factors for urinary tract infection. Preventive measures for UTI. The simplest will be to drink plenty of fluids, especially water. Drinking water helps dilute your urine and ensures that you will urinate more frequently. So allowing the bacteria to be flushed out from your urinary tract before an infection can begin. Okay. So drink a lot of water para ma-flush out yung mga bacteria that might be present in your urinary tract. Empty the bladder, urinary bladder, as soon as there is an urge to urinate, even if it does not feel full. Kahit hindi pa puno, if you feel a little urge already, just urinate. Go to the bathroom and urinate. Practice good hygiene. For females, when you wipe the one below, so you wipe it from the front to the back. The back is where the anus is. Okay, so doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. So if you wipe it from the back to the front, then you might contaminate your vagina and then your urethra. Empty your bladder soon after sexual intercourse. Also drink a full glass of water to help flush out the bacteria that might be entering your urethra. Then avoid potentially irritating feminine products. Using deodorant sprays and other feminine products such as douche and powders in the genital area can irritate the urethra. Change your birth control methods. So diaphragms and lubricated spermicide-treated condoms can also contribute to bacterial growth. Now let's go to the signs and symptoms of urinary tract infection. When you have urethritis, usually you have burning sensation on urination. Yung pag-ihi mo, medyo mainit, masakit, no? Okay. So that is a very reliable clue that you might be dealing with urethritis. May inflammation at least, kung hindi infection. Okay. So sometimes you just have inflammation without infection. Okay. But at times the inflammation can go further and proceed to infection. Then if you have discharge from the urethra, okay, then we think of urethritis. Okay. This is also very notorious among men when they have discharge now after a sexual intercourse with some unknown women. Then so you have so-called sexually transmitted disease, discharge from the urethra. Now, cystitis, meaning infection of the urinary bladder, usually, aside from the other symptoms of, let's say, difficulty in urination, okay, painful urination, then cloudy and bloody urine, you have a lower abdominal discomfort. When you say lower abdominal discomfort, dun sa may puson, okay, medyo mabigat, masakit, no? Then you think of cystitis. Then, if you have flank pain, yung bandang itaas na, flank pain means lumbar area or dun sa itaas, sa balakang, no? Then usually pyelonephritis ang pinag-uusapan, pyelonephritis, because that's where the kidney is located. Okay, so at times you may have fever, then frequent urination, and at times cloudy and bloody urine. So just take note of these three group of symptoms and signs: urethritis, cystitis, pyelonephritis. So just remember the keywords here: flank pain, cystitis dito sa puson, and then urethritis just sa pinakababa. Diagnostic test, the usual diagnostic test will be urinalysis and urine culture. Okay. So the indications for doing diagnostic tests for possible UTI will be when you want to screen patients with high risk for UTI and other diseases that can be detected in the urine examination. Okay. Because when I say can be detected in urine examination, the examination of the urine not only detect infection, but it can detect other diseases. Okay. So that's why I said you can do this urinalysis when you want to screen not only for UTI, but for other diseases like diabetes, pwede, kung may sugar sa urine, okay? So this is not part of UTI, but you can diagnose a diabetes through the urine. The other indication for doing a diagnostic test for possible UTI will be when you have a diagnosis in those with symptoms and signs of UTI, which I mentioned, urethritis, cystitis, and pyelonephritis. You suspect those three. Okay, then you want to firm up your diagnosis, then you do your diagnostic test. Okay? And once it's positive, then you can still use it to monitor the treatment results kung nawawala na, kung nag-i-improve yung mga laboratory findings. Okay? So, and a word about the risk for doing screening left and right, because as I said, we have to be careful in selecting the indications for doing the urinary test, okay, and also urine culture. As if you do it left and right, okay, kahit na wala akong nararamdaman, just want to do it kasi maraming gumagawa, then it might lead to overdiagnosis or false positive results. No? Unnecessary further tests. If you have overdiagnosis and it's false positive, it can lead to further tests and then unnecessary treatment kung di man kailangan because of false positive results. So when you say unnecessary treatment, it could be unnecessary treatment for asymptomatic bacteriuria, which are quite common, and then this will also lead to misuse of the antibiotics, which can lead to antibiotic resistance, which we discussed last time, or the other Saturday. So urinalysis as a diagnostic test. This test will examine the urine for red blood cells, white blood cells, and bacteria. So the number of white and red blood cells found in your urine can actually indicate an infection. I will show you why later, how it's being interpreted. So when do you do urinalysis? Okay. Screening for high-risk patients for UTI, firming up suspicion because of some symptoms, and then monitoring after initiation of treatment. So these are the three indications. When you say urinalysis, it's also a layman's term. It's a urine test that examines the visual and chemical and microscopic aspect of your urine. So usually it's reported in three groups of findings: color and appearance. And it's sabihin na, amber color, yellow color, appearance, cloudy, clear. Those are examples of results. Then chemical findings, let's say if you have proteinuria, protein in the urine, or sugar, okay? So those are ketones. So those are examples of chemical findings. Microscopic findings, if you have WBC seen on microscope, RBC, bacteria, etc. Okay. So usually these are the three types of findings that being reported in a typical urinalysis. Okay, as I said, the urinalysis can do other tests aside from looking for urinary tract infection. Example, when you have proteinuria or protein in the urine, it might manifest, it might point to a kidney disease, not necessarily UTI, but a kidney disease. When you have glycosuria or sugar in the urine, it might point to a presence of diabetes. A urine culture, usually with a sensitivity test, usually pag ginawa yung urine culture, usually palagi may kasamang sensitivity test na. Sensitivity test is for the antibiotics. So a urine culture is used to determine the type of bacteria. You want to know what bacteria is present. You want to culture the urine. And this is an important test because it helps determine the appropriate treatment, because you want to subject it to sensitivity, to what antibiotics. Okay. So when you say culture, it's the laboratory will just grow the germs, the bacteria in a dish for a couple of days to find out which type of bacteria is present. So usually it will take at least 3 days for you to have growth in the dish, and then this will be reported to you. Okay. So when do you do urine culture? When there is a need to identify the specific type of bacteria in the urine. So a reason could be not responding to empiric antibiotic treatment. Okay. And when there is a need to determine what antibiotics to be used, as I said, urine culture is usually followed by a antibiotic sensitivity test. If the infection does not respond to treatment, the usual treatment that are given, or if it keeps on recurring, paulit-ulit, the following may be done to investigate further. Because usually pag ordinary without any other complicated findings, usually gumagaling na yun. So pag hindi pag gumagaling at keep on recurring, then you may have to undergo an ultrasound, okay, to check the kung meron pang hidden findings doon. Then cystoscopy, meaning you insert a scope to see the inside of the bladder, okay, to see what's wrong there. Or at times a CT scan may have to be done also. So these are the more sophisticated diagnostic tests. How to interpret urinalysis in UTI? Okay, so we're talking about UTI now. Okay, so we look for pyuria, hematuria, and bacteriuria. Okay. So pyuria means represented by WBC, yung mga pus. Now this represent the pus. So if you have abnormal amount of WBC based on the count, then you call it pyuria. If you have abnormal amount of RBC or red blood cells, then we call it hematuria, blood in the urine. And then if there's presence of bacteria seen on microscope, then we call that bacteriuria. Here I have a statement here, but not all UTIs have detectable pyuria, hematuria, and bacteriuria. Okay, so some of them will have just inflammation, but still no pyuria, hematuria, or bacteriuria. Okay, WBC on urinalysis. Okay, the number of WBC is considered normal is typically 2 to 5 per high power field or less. Okay, this is the usual numbers given. Okay, but this you have to take a look at the laboratory reference range, okay, and use that as a guide. If it says 3 to 5, you just follow that. Okay, and then the RBC usually less than 2 RBCs per high power field. So if you have 2, normal pa rin yun. Okay, so the other thing that we have to do is to correlate clinically. Okay, kung merong abnormal results pero wala namang symptoms, then you have to think twice. Okay. So it's important to know if there are symptoms of UTI or not, okay, which I mentioned already, symptoms of urethritis, symptom of cystitis, symptom of pyelonephritis. Now for the bacteria, okay, so if you have bacteria in the urine sediment, these are usually due to infection or contamination. Okay. So not every time that you have bacteria in your urine means that you have infection. It could still be contamination. But normally there's no bacteria that should be seen in the sediment. Okay. However, given the abundance of normal microbial flora in the vagina, there are a lot of normal flora, okay, and also the external urethral hiatus, okay. Then bacteria may multiply rapidly if the urine specimen is left standing for too long in the room temperature. Okay. So kung matagal yung pagka-examine ng urine after the collection, there might be a false reading. Okay. Or if it's not collected properly, the urine can contain bacteria that was contaminated from the surrounding anus or the vagina. Okay. So if bacteriuria is found and the UTI is suspected because there are symptoms, then a urine culture with sensitivities is recommended. Okay. Again, this is done after kung hindi siya gumagaling with the usual first-line medical treatment. So how to count the bacteriuria here? Generally, 100,000 ml or more of a single organism reflects significant bacteriuria. If less than that, usually it's a contamination. So the presence of multiple organisms, especially less than 100,000, typically suggests polymicrobial contamination. So we must know how to interpret. So the magic number here is 100,000 per ml. If it's less than that, usually we don't put too much importance. But if it's more than 100,000, we put some weight on it already. But we also start ruling out contamination. So methods of urine collection to prevent contamination. There are usually three methods: the so-called clean cuts collection, catheterization using a catheter, suprapubic tap, meaning you insert a needle through the puson to get to aspirate the urine from the bladder. Okay. So we will not talk about catheterization and suprapubic tap this afternoon. We will just focus on the clean cuts collection. When you say clean cuts collection, it means catching the midstream. Midstream means umihi ka muna, labasin mo yung initial flow and then catch it while you're still urinating. Okay, so this is to avoid contaminated results. It is important to wash your hands with soap and water before you start collecting. Okay. Then you collect the sample as instructed. Okay. So this is for females. Okay. Collecting a clean catch urine samples. If you have labia, that means you're females. They try to avoid using females kasi maraming issues dito. Basta labia na lang, may labia. Okay. Kasi may mga tinatawag na pseudo-female. Okay. So start by sitting on the toilet with your legs spread apart. Using 2 fingers, spread your labia open. Then use one sterile wipe to clean the inner folds of your labia, wiping from the front to the back. Okay, palaging front to the back, not back to the front. Use another sterile wipe to clean over the urethra, especially the opening. Okay, so when I say urethra, it refers to the opening where the urine flows out of your body. So you wipe it again, then urinate a small amount into the toilet. Palabasin mo muna yung initial flow, then stop the flow if you can. Kung hindi, just hold the specimen cup a few inches away from your urethra and then catch the remaining urine that is coming out. Okay. Then urinate into the cup, filling it about half full or however full your provider instructed you to do. Then after that, pag na-catch mo na, nasa cup na, then you can complete your urination into the toilet bowl. Now for males, usually if you have a penis na lang, if you have a penis, okay, so use a sterile wipe to clean the head of your penis. If your penis is uncircumcised, just first pull back the foreskin to ensure a thorough cleaning para hindi ma-contaminate also the urine. Urinate a small amount into the toilet. Stop the flow of the urine and hold the specimen cup a few inches from your urethra, the opening where the urine flows out of your penis, and then fill your specimen cup about half full or whatever amount your provider will instruct you to do, and then finish urinating into the toilet. The urine specimen must be analyzed within 30 to 60 minutes after the patient voids to avoid erroneous or confusing results. I don't know how strict are this is being observed by the laboratories, especially if there are a lot of urine requests for tests. So, but this is a big factor in the false results. Okay, the urine should be examined within 30 to 60 minutes. Now let's go to asymptomatic bacteriuria. So, asymptomatic bacteriuria, let's just call it ABU, refers to isolation of or detection of bacteria in a appropriately collected specimen, yung tamang collection, from an individual without symptoms, without symptoms of urinary tract infection. So it's important to differentiate asymptomatic bacteriuria from contaminated bacteriuria. So when you say asymptomatic bacteriuria, talagang may bacteriuria. Okay? Kahit na walang symptoms, pero meron siyang bacteriuria. Meron bacteria in the urine. Contaminated bacteriuria will be a false positive bacteriuria brought about by contamination. So yung asymptomatic is not brought about by contamination. Talagang merong bacteria in the urine. Laboratory criteria for the diagnosis of ABU in the midstream clean cuts urine specimen are as follows. For women, when you have 2 consecutive specimens with isolation of at least 100,000 or more colony-forming units, then you start thinking of asymptomatic bacteriuria. Basta walang symptoms of UTI. For men, kasi sabi natin, maraming incidence of contamination with women compared to men. Yung sa men, a single specimen pwede na. When you have 1 single specimen with isolation of 100,000 colony-forming units at least, it can be more, then start suspecting asymptomatic bacteriuria. So the frequency of asymptomatic bacteria in the adult population, this data are gotten in the US. So you can see that it's quite common, 1 to 5% in premenopausal women, 1 in pregnant women, maabot ng 9.5, and then yung mga may edad na 50 to 70, as high as 8.6, 870 and older in the communities, as high as 16%. In men naman, men 70 years old or older, maabot ng 19%. And then women with diabetes, you can have 16%. Men with diabetes, 11%. So this is commonly seen in practice. So we must know how to treat that. And if you don't know, you're gonna end up with a lot of unnecessary treatment and also antibiotic resistance. The question is, can you have bacteria in your urine and not have UTI? So asymptomatic bacteria is a condition in which the bacteria are present in non-contaminated urine sample collected from a patient without signs and symptoms related to a urinary tract, related to the urinary tract. So asymptomatic bacteriuria without signs and symptoms of UTI we don't call it UTI. Okay? So importante may symptoms ng UTI. You may have bacteria in your urine based on the examination, pero wala kang symptoms, we don't call that UTI. Asymptomatic bacteriuria does sometimes go away on its own, but it also often comes back or persists. But for most people, asymptomatic bacteriuria does not cause any problems and treatment is not usually necessary. Now, if you develop a urinary tract infection, this time with symptoms, then on top of the asymptomatic bacteriuria, let's say nagkaroon ka ng asymptomatic bacteriuria and then you observe and then you develop urinary tract infection, meaning you have symptoms, then treatment with antibiotics will almost take care of it. The question is, do you treat asymptomatic bacteriuria in the elderly? As I said kanina, this is one of the slides. It's quite common in the patients who are elderly. So treatment should be administered to patients of any age with symptomatic urinary tract infection. So that's the first rule. Pag mayroong symptoms of urinary tract infections, may mga nararamdaman na pain and urination, discharge, pain sa puson, pain on the flank, then it has to be treated. Okay, but especially if you have bacteriuria there. But many believe that bacteriuria in the elderly, mga matatanda, in the absence of symptoms or obstructions, is benign and should not be treated. Pwedeng hindi gamatin. No? Let it be, observe lang. So in most patient populations, treatment of ABU is not clinically beneficial, and consequently, screening for ABU is not recommended. So you don't have to screen for it because you don't need treatment anymore. So the U.S. Preventive Service Task Force advises screening men and non-pregnant women. Non-pregnant, yung pregnant women, iba yun, no? Okay, later on in that last statement in this slide. So men and non-pregnant women for asymptomatic bacteria, so they don't advise screening, and there is adequate evidence to suggest that screening is not effective in improving the clinical outcome. But an exception will be in those with pregnant women because of the risk of renal kidney problem. Okay, ABU carries significant risk and treatment provides important benefits. So pregnant women, go ahead. How are UTI being treated? Usually antibiotics. The commonly used antibiotics are the following, and dami, no? Nitrofurantoin, sulfonamides, amoxicillin, cephalosporin, trimethoprim, sulfamethoxazole, doxycycline, quinolones. Okay, so on the other part of the table on the slides is another list. Okay. So the first line antibiotics usually are selected, and then these are the nitrofurantoin, fosfomycin, sulfamethoxazole, or trimethoprim. Then the second line will be the amoxicillin, clovulanate, and certain cephalosporin may be appropriate when the first line of options cannot be used. Side effects of antibiotics, some of them listed here: rashes, diarrhea, nausea, vomiting, headache, then tendon or nerve damage. Okay, so this can happen. So when you use antibiotics to treat the UTI as well as for other infections. Okay, so take note that the fluoroquinolone antibiotics such as levofloxacin and ciprofloxacin appear to increase the risk for perineural neuropathy by 47%. Mataas, no? So they also increase the risk for tendon damage. So you have to be careful in using this one. Use this as a last resort. Okay. So when you have to use antibiotics, use the first line, then second line. Then kung talagang kailangan, then you take this fluoroquinolone antibiotics. There's such a thing as complicated and uncomplicated UTI. So uncomplicated UTI means the urinary tract is normal, but there is infection, meaning there's no structural abnormality, walang obstruction, walang duplication of ureter, ganon. Okay. Complicated UTI means there's a disease or problems with or in the urinary tract. So yung complicated UTI require fixing of the disease or problem in the urinary tract. Example, if there's a stone, it has to be removed. Okay, if there's a tumor, it has to be removed. Okay, and then it may require higher doses of antibiotics. Severe infections of the kidney may require the following: higher dose of the antibiotics, whether parenteral or oral, and then at times you may need to do parenteral antibiotics. You may have to give parenteral instead of just oral. And then again, at times you may have to be treated on an inpatient basis within the hospitals for close observation. As I said, there are usually many options in the selection of antibiotics. I cannot tell you which one to use. The physician will have to decide, and the decision should be based on the BRCA, meaning the benefit, risk, cost, availability. Okay, so first column just list down all the possible antibiotics, first line, second line, third line, and then the benefit, the risk, cost, availability. Then make a decision. How long to take the antibiotics? Typically, for the so-called uncomplicated, take the antibiotics for 2 to 3 days. Some people will need to take the antibiotics for up to 7 days. Some even 1 day, because there's a preparation called fosfomycin. You can take it for 1 day, but it's quite expensive. Okay. For a complicated infection, one might need to take the antibiotics 14 days or more. So if there are symptoms after completing the antibiotics, and if the urine tests still show positive results, then you may have to take the antibiotics for a longer period of time. If one gets UTI often, paulit-ulit, one may need a prolonged course, mas mahaba ang pagpigay. And if sex causes UTI, so usually the advice is take a dose of the medicine right before the sex. Now, why should I take the full dose? Antibiotics work well against UTI, usually very effective. You might start to feel better after being on the medicine for just a few days. But even so, keep taking your medicine, your antibiotics. If you stop your antibiotics too soon, you won't kill all the bacteria in the urinary tract. Okay. So the first message here is that make sure that you're taking the right duration of your antibiotics so as to avoid yung mga natitirang bacteria that are not killed, because these natitirang bacteria will now become resistant to your future antibiotics. Okay, so these germs become resistant to antibiotics. That means the meds will no longer kill these bugs in the future. So if you get another UTI, the medication you take might not be able to treat it. So take the full course of your medicine to make sure that all the bacteria are dead. And what is the prognosis? Typically, they usually respond very well to treatment. Usually walang problema. If there are frequent UTIs or symptoms aren't improving, antibiotic-resistant infection is to be considered. Hindi na gumagana. And these are more complicated infections to treat and may require intravenous antibiotics, but that means through IV or IM or alternative treatment. Sometimes the body can resolve minor uncomplicated UTI on its own without antibiotics. So by some estimates, 25 to 42% of uncomplicated UTI clear on their own. Just drink a lot of water and it might disappear as long as it's not complicated. And inappropriate practice around urine testing can contribute to overdiagnosis of urinary tract infection, as I said, false positive, and then overtreatment of asymptomatic bacteriuria, as well as inappropriate use of antibiotics that can contribute to antibiotic resistance. So I'm now giving some advocating statements and advice on UTI. So many cases of uncomplicated UTIs will resolve spontaneously. Take note of that, without treatment, but many patients will seek therapy for symptom relief. And treatment is aimed at preventing the spread of to the kidneys and developing into the upper tract disease like pyelonephritis, which can cause destruction of the delicate structures in the kidneys and lead to hypertension and other kidney diseases. The diagnosis of UTI is made from the clinical history, yung mga symptoms na sinabi ko, and urinalysis, confirmed by urinalysis with, if need be, confirmation by a urine culture. But the proper collection of the urine specimen is important. So if a test shows bacteria, does it mean that I have UTI? Let me repeat, not necessarily. Diagnosis of UTI requires that both findings of bacteria on the urine test and the presence of specific symptoms. Dapat may symptoms. Having both is important because bacteria can and do live naturally in the bladder without causing any pain or symptoms. So this is what is called asymptomatic bacteriuria. So which is usually present in as many as half of the seniors living in a long-term care settings like nursing homes. If you have UTI, take antibiotics as prescribed by your physician and as instructed on the length of intake. So it depends also on the type of antibiotics that they're taking. Then help in the prevention of the antibiotic resistance. So why should I take a full dose? As I said, we want to kill all the bacteria, lahat, and then to avoid antibiotic resistance. So summary and takeaway, I have discussed the following. What is UTI? Causes, preventive measures, symptoms and signs. usual diagnostic tests, how to interpret, how to collect, and what is asymptomatic bacteriuria and how they are being treated. And then what is the prognosis of UTI and what are my recommendations on what to do. Okay. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on urinary tract infection. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in medical management of oneself and also your relatives by knowing the fundamentals and generalities of urinary tract infections in health management. So with that, I end my pep talk today. I hope I have empowered you to have an understanding of the fundamentals and generalities of UTI in your health management. So let's, before we go to the open forum, reminder, Olete, please take the Olete, then Olete certificates, 51 voucher, and then please put your feedback on the chat box, and then let's now have a group picture taking. Okay, ready, everybody? Nandiyan na lahat may 1, 2, 3. Okay. Okay, so the floor is now open for open forum. Questions, comments, free consultations, etc. Any, okay.
And togetherness, because it's really personal.
You watch that every year?
Every year.
It's
I
good.
just remember that she was clean for such a long time. I don't
Anything on the chat box? Okay.
It's incredibly sad that the Queen has passed. I feel it's great respect for her and what she's done for this country as leader of the country and leader of the church. Does anybody here believe that?
Can you mute yourself, Mana? Wala. Maria is na Palatan.
know.
Can you, who's talking? Okay. So there's a sharing. Haba, okay. Ladies, can you read this one? Sharing. Is there? Abet, ladies, there's a sharing here.
Ate Raj, will or I will read na lang. This is from Jocelyn T. sharing. One night, just months ago, I was brought to the ER due to numerous symptoms, close in parentheses, nausea, stomach pain, radiating to the back, feeling of fever, although thermometer indicated no fever, slight LBM, extreme dizziness to the extent that I cannot stand nor sit long. Food poisoning was my first suspicion. At the end, the finding was UTI. I should have avoided spending 18K for the few hours I was at the ER with a simple urinalysis. I cannot forget the painful intravenous injection for my stomach pain that night. After finishing my antibiotic, my urine culture result, no pathogen isolate. Lesson: if a laboratory is nearby, better have urinalysis done.
Okay. Thank you for sharing. Any comments? Any reactions from the group? Any reactions from the group? So my first reaction, if you don't have any reaction, is lesson. If a laboratory is nearby, better to have urinalysis done. Okay, one reaction there. There's a question is, when do you go to the ER? Yan ang palaging tanong. When do you go to the ER? No? So there are indications to go to the ER, but you may have to do self-assessment muna. No? Kaya importante itong patient empowerment program natin. If you know how to make a self-diagnosis, kahit na yung pinaka-crude, no? Anyway, there's no such thing as perfect. Even doctors do not get 100% accuracy in their diagnosis, di ba? So at least meron kang idea, and then you also have the option to observe. That's what I'm telling you. Observe very closely, no, before you go to the ER. The moment pumasok ka ng ER, track ka na doon. Okay.
Daming saksak.
Okay. So the moment you enter the ER, you are trapped. Be ready to spend. If it's a private hospital, okay, they do everything for you. Okay. Okay. Hindi yung they don't focus on the one problem that you are presenting. They do a lot of tests. Tira. Now,
Yes, Doc. I resisted the chest x-ray pero pinilit ako.
you can sign. You can sign in.
Wala akong magawa that time. Pinilit talaga eh.
You can sign a waiver if you don't really want it. No. Okay, but of course you have to ask the doctor why do I have to need the chest X-ray? You ask why. No. Okay, kung sensible naman yung answer niya, then you go for it. No. I'm not going to tell you don't follow them, di ba? But you have to make a judgment. No. Okay, and then the other one is telemedical consultation. No. Okay, nowadays there are a lot of telemedical consultation. You consult a doctor right away, no, to help you
Doc,
make an
It
assessment.
happened at night. Kaya wala din akong laboratory mapuntahan except the hospital.
Kasi hindi mo na matiis, no?
Hindi matiis ng anak ko. Sabi niya, ma'am, malapit lang tayo sa hospital. Let's go. Sabi.
Okay. Okay. I don't think that's a valid reason kasi malapit tayo sa hospital. Okay.
Ayaw niya kasi makitang suffering.
Yeah. Okay. So I guess the best approach is try to assess yourself first, no? And then kung talagang hindi mo na kaya, talagang when you say hindi mo kaya, assess yourself, no? And then number two, hindi mo kaya yung symptoms, masakit na, and then go to the hospital, no? Okay. Or what time this happened? Kagabi?
Around 7:30 in the evening.
Oh. Meron ka if you have a family doctors, gisingin mo.
Wala po, Doc eh. Walang ganun eh.
Text me.
Talaga, sige noted, Doc.
Because my telemedical, sabi ko sa telemedical slides ko na if you have any problem, don't rush to the ER because of so many COVID before, di ba? Okay. So medical mo na, then ask the doctor to give you an initial assessment. No? Kung sinabi ng doctor, go ahead, go to the ER, then you go. No? Okay. Okay?
Okay, thank you.
Okay, next.
Ate Rides, will you do it or I will be the one? Okay, the next one is from Emily Muyot. Are the UTI test sticks reliable to detecting UTI?
Okay, when you say reliable, okay, probably talk about the accuracy. Di ba? Okay, so lahat ng test, whether urinalysis, urine culture, yung test sticks, or I don't know whether it's the same as dipstick, no? Okay, may kanya-kanyang advantages, disadvantages, no? Okay, so some will have false positive, some will have true positive, some will have false negative, false positive, true negatives, no? So it has to be interpreted correlated based on the clinical ground, na palaging yung clinical. Kung may nararamdaman ka, tapos dipstick mo is positive, most likely you have, kahit na dipstick is a little cheaper than ano, no? Okay, yung mga, tama, cheaper than urinalysis, gano'n. Okay. So, if it's, kung meron kang symptoms, most likely tama na yun. Na? So, let's just put it at that because when you say reliable, your question is reliable, there are shortcomings in all the tests, then you have to ibabangga mo sa clinical palagi yung mga symptoms mo and then come out with a diagnosis. Okay, as much as possible, it should come from the doctor who does clinical correlation. Okay, there are doctors who just rely on laboratory, di ba? Okay, so they don't go clinical. No? So, ang pinaka-importante doon, ibabangga mo palagi sa clinical, then come out with a diagnosis. In my example, as I said, kung wala kang nararamdaman, then yung dipstick mo positive, then you may have to repeat it. No? Repeat it or do another test. No? Kaya sabi ko nga rin sa inyo, you have to do your test based on indications. So if you have a false positive results, tapos hindi siya natutugma sa symptoms mo, you may have to do more tests. No? Baka mas mahal yung mga tests ang dadaanan mo. No? And then eventually, baka kung mali pa rin yung test and the next test will be mali, then you may have to be given antibiotics. Baka hindi mo rin kailangan. No? Okay. So just take note of those caveats. No? Okay, did I answer your question, Emily? Okay.
Okay, there is
Yes, Doc, thank you.
Okay, thank you.
Okay, there is another one from Melingo. In a urinalysis, is pH a specific gravity, phosphate, urate, significance, or does it mean anything? What are ketones? Thanks, Doc.
As I said, when you do your analysis, maraming hinahanap, no? Yung color, yung chemical composition, and then also the microscopic, no? Okay. So other information that you have there is pH. pH, you see, usually it will say whether it's ano ba yung 7.4 ang normal, di ba? Okay, 7.4 tama ba? If I know my basic physics, no? Above that, no? Above that will be alkaline, no? Below that will be acidic, no? Okay. So usually it cannot stand alone. Kung wala ka ng symptoms, no? You can have acidic, you can have a little base or ano ba yung base? How do you? Okay, basta hindi siya acidic, na? Okay. So kung wala namang symptoms, you just disregard it, na? Specific gravity, ganun din, na? Okay, they will give you a number, and then phosphate, if you have a lot of stones, kung mataas ang phosphate mo, then you correlate it, baka meron kang mga baka may stones ka sa katawan, ganon, urates, ganon din, baka uric acids, no? Okay. And then ketones usually related to diabetes yon, no? Aside from glycosuria, looking at the sugar in the urine, when you have sugar in the urine, you call that glycosuria. Then if you have ketones, no, it will also point to diabetes, no? Okay. Yung tinatawag na ketone acidosis, na ganon. Lumalabas yung mga substances dun sa urine, na. So you have to correlate it with your clinical findings, na. Okay.
There is a comment from Susan Tan. Doc Hoson, many thanks for another informative session. Appreciate your kindness.
Okay, thank you also for attending, Susan. Okay, any more questions?
There's no more at the chat box.
How many has experienced being treated for asymptomatic bacteriuria?
Not me.
How many have experienced being having repeat urinalysis because of one abnormal urinalysis? Meron?
None.
Kung wala, lucky kayo.
Urinalysis dahil sa UTI.
Ah, ano?
Maraming urinalysis dahil sa UTI.
Maraming, yeah, once you do your urine, kung mayroon kang symptoms,
May symptoms.
my suggestions, if you have symptoms, that's the time you go for urinalysis. Kung wala kang symptoms, no, you don't have to go for urinalysis. No, just rely on your drinking a lot of fluid. No, basta maraming ihi lumalabas, hindi masakit, okay na yan. No, okay.
Okay.
Okay, kasi if you, lalo kayo mga babae, if you have your urinalysis done, a lot of times contaminated yun eh. So, even the physicians mahirap mag-determine is it contaminated or not, di ba? Then, the tendency is for them to give you the prescription for antibiotics. They would rather err on that side, no? Okay. So, kasi kung i-repeat mo yung urinalysis mo, mali pa rin ang collection methods mo, siguradong sasabihin, ay, may UTI ka talaga. No?
There is another question, Doctor, from Melly. Doc, why do they check pre and post voiding urine volumes?
Kamisan, this is ultrasound. Sa ultrasound ito.
Ultrasound of the whole abdomen.
Kaya nga, sa ultrasound ito, di ba?
Yes, Doc.
So, titingnan lang nila yung... Kasi, di ba, pinapainom kayo ng tubig?
Yeah,
Yes.
Okay.
they have full bladder.
Full bladder. No?
Oo.
So, parang routine na lang nila yun eh. Pero sa akin, I don't put too much importance on that. No? Unless meron kang problems in the urinary tract. Okay. So let me check. Now that you asked me, no, I have to answer you more in detail. No, tatanong ko sa kanila, now what's the rationale for doing this one, even for those without any problems in the urinary system. No, okay.
Yes, Doc. Thank you, Doc.
Okay, there is another one from Jocelyn P. When is a cystoscopy prescribed to be done? Nephrologists do it?
Cystoscopy means you insert a scope. The scope papasok through your urethra and then to the bladder, urinary bladder. So when you say scope, it's a visualization at first, no? So titingnan nila yung bladder mo. Kung merong mga unusual findings like kung may growth sa wall, no? Ganon. Kung may tumor, ganon, no? Okay. So they look at it, then if they find something there, they will do a biopsy. Okay, cystoscopy plus biopsy, no? So when is it prescribed? When your physician or you suspect that there is something more than UTI there. Okay, if there is a tumor, if there is something unusual now in the urinary bladder that cannot be detected by yung mga CT scan, no, ganon, no, or ultrasound, no. So when it is being done, who does it? Usually, urologists ang gumagawa. Usually. Urologists, not nephrologists. Unless pasukan ng nephrologist yon. Nowadays, yung medicine nag-overlap na eh. No? Okay. So, baka yung mga nephrologists gusto gumawa ng cystoscopy para makikita, no? Kasi procedure yon. Okay, they can do it as long as they undergo training. No?
Thank you, Doc.
At the moment, it's the urologist.
Okay, thank you,
I
Doc.
have,
Question?
Doc, I have something. I have about the cystoscopy. Remember I told you about my friend who had bladder cancer.
Yeah.
Oo, that ang nangyari ho because ang first diagnosis was UTI kasi nga masakit ang when she peed, it was very painful, burning sensation. So she was taking the medication for over a month. Kasi
Okay.
hindi gumagaling.
Antibiotic siya, na? Antibiotics.
Oo.
Okay.
Yes, antibiotics. So every time we would meet in our, we had a prayer group ho, Saturday even she was saying, ang sakit-sakit, hindi pa gumagaling. Taas, palit ng until siguro nag-give up na yung doktor. Sabi, pumunta ka ng urologist. And ayun na nga po, nung inanuhan siya ng cystoscopy, may siya. She had a tumor and it was malignant. And yun na yun. Namatay na nga ho, my good friend died na 2 weeks ago. Mabilis ho. It was stage 4 nung nakita. Wala po siyang naramdaman except nung last December, na napakasakit nung kanyang pag-urinate. Doon hulang niya na, doon nag-umpisa yung, doon lang, that was the only time she realized there was something wrong. And then, ayun. So,
how old is your friend?
My friend, 66.
66. Okay, let me try
Yes.
to analyze it. So, first symptoms niya, masakit yung pag-ihi niya.
Masakit lang po. Opo.
Walang-
Nothing else.
Walang dugo.
Yun ho, nung nagdugo na siya, that was when the doctor, the first doctor said, okay, this is something else. But that was after taking about a month, more than a month of antibiotics. Lumabas ho yung blood na talagang parang, as in her words, parang faucet ang pagdugo niya. So sabi, okay, hindi, go na.
Did she have a urinalysis? Did she have a urinalysis?
Yes, she did. She had urinalysis.
I suppose may RBC lumabas doon. Wala?
Ang sabi lang ho, yes, you have blood in urine, the usual thing ho. You have red blood cells, ganon. So, lagyan ng that's it. Antibiotic lang ho, ang unang diagnosis talaga UTI lang.
Okay.
She never told us kung gaano karami yung niya, red blood cells. But I'm supposing marami ho because nobody will just give an antibiotic for, usually ho, di ba? It's not, pag mataas na,
kasi kung first time din, unless the doctor is suspecting, pero usually short term lang yan mga 1 week.
Opo.
Then
Opo.
after that, kung hindi siya gumana, pag hindi siya gumana doon, then they will have repeat urinalysis or whatever. And then, para to shorten yung delay, no? Kasi nadi-delay 1 month, di ba? Okay. So, baka kung after 1 week, 2 weeks of antibiotics, baka nagpa-ultrasound na siya, baka nakita yon. Na-ultrasound siya?
Hindi po. Na po, dun sa cystoscopy na lang nakita. Hindi na ho siya dumaan ng ultrasound.
Walang CT scan? Wala rin?
Wala rin, hindi. Diniretso na ho siya sa cystoscopy. Kaya maraming masakit ng dinanas niya. It's very painful. Tapos she underwent bladder removal.
Okay. That's a treatment already. That's a treatment. Pero importante yung diagnosis mo na, no? So,
yun nga po that was why lahat kami, bakit hindi, at saka hindi niya naramdaman, wala siyang ibang naramdaman kung hindi biglang masakit siyang umihi.
Okay.
Hindi ba, parang ang hirap po parang ewan ko, hindi ko.
Okay. So what we want, the lessons that we can learn there is when do you jump to another test? Okay, kasi kung may symptoms, mo-monitor may symptoms kung gumagaling o hindi. Kung di gumagaling, then the doctor will have to be more aggressive na, di ba? Initially, pwedeng observation, antibiotics, no? And after that, hindi ko gumagaling, then go to the next higher, higher test, no? Ganon.
Then another another friend, another friend who had a doctor friend said it's very important, like in your talk, to empty your bladder. Talaga ho, you have to make sure that it's all out, because sometimes we don't, minsan nagmamadali parang initial then you go. So we're told you have to drink a lot talaga ho. Drink a lot and then
Drink a
empty your
lot and
bladder.
then pee a lot. Drink a
Pee
lot and pee a
exactly
lot.
ho.
Okay.
And empty ho.
Okay.
So yun, lalo na sa tumatanda. Very important ho
Pero
talaga.
ang ingat kayo when you tell the doctors, madalas akong umihi.
Oo,
Pag sinabi madalas umihi, baka may diabetes nito.
Oo, yun ho. Nakakatakot.
Okay.
I'd like to share something with the group ho. One more thing. Don't be never falter in contacting Dr. Joson at night. Because I remember during the height of COVID, I got talagang terrible throat. Yung pala, it was tonsillitis. I was so afraid. Nakakita na ako ng nana sa tonsils ko. Sabi ko, Diyos ko, ano ba to? COVID na ba to? So talaga hong I texted Dr. Joson, and that night he said, sige, we will have teleconference at night. So please, kasi at ease ho talaga, nakakatakot ng COVID. Baka kung ano na yung sakit ko. So don't hesitate. It's very important.
Yeah.
Thank you.
Okay.
Oo, very important.
There
Okay.
is, okay.
Sige. Hindi. Okay. Just to reinforce na, okay. I do face-to-face once a week muna, but I still continue with my telemedical. Na? Yung telemedical, you can text me anytime. No? Then I will, wag lang alauna, no? Kasi tulog na ako doon. Okay, alauna up to 6 o'clock, kanon. Baka tulog ako doon, no? Okay. I usually turn off my cell phone na, no? Okay. But in other times, no, you just text me. Text me, no? The best way is to text me, not by Facebook account, Messenger. Kasi hindi ko nakikita yun every hour, no? Okay. Okay. So, any more?
Yeah, there is another one from Melingo. What about foamy or bubbles in urine? Does it mean diabetes?
Usually, my experience that wala yan eh. Normal lang yan sometimes, no? So, you just observe, kamisan nawawala, kamisan, no? Okay. So, I have some patients who complain, bubbles. Say, take a picture. Monitor namin. Wala naman siya nararamdaman, no? Okay. So, eventually, nag-decrease lang siya, no? I suppose some of you have bubbles also, once in a while,
Yes.
di ba? Okay, nawawala naman, no? So, it doesn't automatically doesn't mean diabetes, no? Okay. It could be normal, no? The only bubbles that you will have there, kung talagang significant, kung may fistula ka. Let's say kung galing ka sa, meron kang abnormal connection between the intestine, kasi intestine may hangin, di ba? So pumunta dun sa bladder mo, no? May abnormal connection, no? So you can have bubble there, no? So, but before you can have those bubbles in the urine, may una kang mararamdaman dun sa intestine mo. Okay. Pero kung wala kang ibang nararamdaman, just bubbles, no? Just observe lang and think positively, okay, matatakot. Na most likely mawala yan. Okay?
Okay. So,
Any more? Okay. So, last
Doc,
one. Yeah.
Doc, yung tanong ko lang po, gaano po ba kabilis yung bacteria from the urethra to the kidney? Kasi kung may mararamdaman ka na bang pain sa tagiliran, tsaka frequent urination, nakaka-worry kung aabot na sa kidney.
we don't, yung rate mahirap
Opo.
i-determine yung rate, no? Ang daming factors depending on the type of bacteria, no? Even the usual bacteria, iba-iba pa yung ano eh. Then it all depends on your body resistance, no? Kung minsan, okay. And then it also depends on kung may obstruction o wala, no? Ganun. Mahirap i-determine, no? So my suggestion is don't be too anxious about the rate, no? But just observe closely lang, no? And hope for the best.
Yes, Doc. Thank you.
Yun
Kasi
lang.
yung sinabi nating symptoms sa UTI, may mga signs ako like frequent urination, although diabetic din naman ako, understood. Tapos may incontinence, parang prone talaga sa UTI kasi minsan yung pads, sanitary pads, yung para hindi yung minsan basa, hindi mo agad na ipapalit. So,
Okay. My suggestion is we feel a lot of things like frequent urination, tapos incontinence, no? Okay. So don't huwag ka masyado mag-worry. Okay? Just keep on peeing. Ilabas mo lang. Keep
Okay
on
po.
peeing. As long as may lumalabas, hindi ba yung magkaroon ng incontinence, mababasa, ano? Basta you keep on peeing. The moment nag-stop
Okay.
yung pee mo, wala ka ng pee. Ako, yan ang masama. No? Okay.
Okay po.
Ako, as a guy, I also have a lot of parang konting gising lang, ihi na ako ng ihi. Kaya I usually make urination 4 times a night, no? Sa gabi, no? Okay. But I'm not worried because maraming ihi lumalabas, di ba? Ganun. Okay.
Okay, Doc. Thank you for your advice.
Kay
Okay.
Melly, Dr. meron pa kay Melly. Doc, yung sa bacteria in a urinalysis, yung ibang test nakalagay lang many, few, walang digits. How will you know the quantity of bacteria in the urine?
Kung urinalysis lang, usually wala silang masyadong quantification, walang definite. But if you have urine culture, meron na yon, sigurado yon. Okay. Pero mahal ang urine culture.
Mahal ang urine culture.
Yeah, mahal ang urine culture. Kaya
Outside.
if you have bacteriuria on your urinalysis, na i-correlate mo sa clinical finding. Kung wala kang nararamdaman, wag mo lang pansinin. Basta uminom ka ng
Tubig.
Yeah.
Okay, Doc. Thank you.
Okay.
Thank you.
Okay. So, wow. It's already 3:24. There were a lot of discussions. Ang ganda, no? Okay. So, we'll call it a day. Wala
Thank
na?
you, Doc.
Wala na?
Thank you,
Yes,
Doc.
thank you.
Okay.
Maraming
you,
salamat.
So,
Ano next topic, Doc?
next
Thank you,
topic.
Doc.
Anong next topic?
Yes.
Gastroenteritis ngayon.
Wow.
Gastroenteritis.
Yung mga,
Thank you.
yung mga common topics muna. Common topics.
Gastroenteritis.
Okay?
Okay,
Thank you,
bye-bye.
Doc.
Thank you.
Thank you very much.
Bye-bye.
Thank you very much.
Thank you, Doc.
Thank you.
Bye.
Thank you. Thank you.
You're welcome.
Doc, bye-bye.
Bye-bye.
Thank you po.